Good morning, esteemed colleagues and aspiring healers. As we gather to talk about the complexity of gestational diabetes mellitus, let's remember that we are not just medical professionals, but also storytellers, crafting narrative of healthy and well-being for our patients. Today, we will embark on a journey that is not only scientific but also deeply human, one that resonates with the essence of compassion, not for our patients, and a profound respect for the sensitive of life. Let's begin with our section by painting a picture of the patient we are about to discuss. Ms. Zhang, a 34-year-old woman, growing with the grace of motherhood as she carried her second child at 28 weeks gestation. Her journey so far has been smooth, with no significant past medical history to note, and her first childbirth was an uncomplicated affair. However, Ms. Zhang's family history is not without its challenge. She carried the weight of a maternal history of type 2 diabetes, a silent specter that looms over her pregnancy. Our patient's present concert is a recent development, a portrait in her pregnancy journey. Ms. Zhang was diagnosed with gestational diabetes mellitus following an abnormal glucose tolerance test at 24 weeks. As we embark on this case study, let's keep in mind the broader implications for our patient's health and the health of her unborn child. This diagnosis is not just a medical label, it's a call to action, a challenge that we, as a clinical team, must rise to meet with empathy, expertise, and a comprehensive plan of care. Our exploration will be guided by critical questions. Let's think not just about the medical what, but also the ethical why. By the end of this case study, you should be equipped with the following learning objectives. As we integrate the resource from clinical key student, and osmosis, let's consider how these tools can enhance our understanding and inform our practice, not just in terms of clinical guidelines, but also in promoting patient empowerment and community health. Our analysis will follow a structured approach, but let's always keep in mind the importance of a holistic perspective. How can each step be tailored to meet the patient's needs, both medical and emotional? History taking is the arm of gathering information. It's the first step in understanding a patient's healthy narrative. For Ms. Zhang, this includes her family history of type 2 diabetes, which is a critical piece in the process of her GDM diagnosis. By meticulously documenting her medical background, we lay the foundation for a comprehensive care plan. Following the narrative of history taking, the physical examination is our next chapter. It's a hands-on approach to assess the patient's current state. For a patient with GDM, this examination can reveal vital signs, check for any complications, and ensure the well-being of both mother and child. It's a clinical conversation with the body that complements the story told during history taking. Our quest begins with the diagnostic criteria for GDM. It's a puzzle that requires a precise touch, where every piece fits according to the guidelines. Let's celebrate the power of knowledge at our fingertips, accessible through platforms like osmosis and clinical key student for further insights into diagnostic tests. Risk assessment is a dynamic process. As we delve into the potential risk GDM pose, we step into the shoes of our patients, understanding their fears and hopes. This is an opportunity to instill the value of holistic care, where the health of the mother and the safety of the fetus are equally paramount. GDM not only poses immediate risk to the health of our patient, Miss Zhang, but also long-term in complications for both her and her unborn child. Complications can range from preeclampsia to potential birth injury due to the macrosomia. Understanding this risk is the first step in our proactive approach to care. Transitioning from the physical to the emotional, we must acknowledge the psychological burden that GDM can place on our patient. Anxiety during pregnancy is more common than we might think, affecting approximately 30% of pregnant women. When a patient like Ms. Zhang reports feelings of anxiety, it's imperative to employ tools like the GAP-7 scoring method to assess the severity and make appropriate referrals to mental health professionals. Let's begin with the cornerstone of GDM management, diet and exercise. It's a lifestyle modification that requires a personalized approach, considering culture, economy, and personal preference. We must guide our patients with empathy, understanding that adherence to these guidelines is not just a medical requirement, but also a commitment to a healthier future for themselves and their children. Our goal is to provide tailored nutritional guidelines that meet the specific calorie and nutritional needs of our patients during pregnancy. This includes regular monitoring of blood glucose levels post-diet to fine-tune carbohydrate intake and meal timing. Exercise is a critical component of GDM management, proven to lower blood glucose levels and improve insulin sensitivity. We must prescribe a safe and effective exercise regimen, typically including lower-impact activities like walking or swimming, and monitor its impact on the patient's glycemia control. The clinical teaching aspect here is to educate patients on the importance of consistency and the dangers of overexertion. Blood glucose monitoring is a cornerstone of GDM care. We must ensure that the patients understanding how to self-monitor their fasting and post-diet glucose levels accurately. The data gained from this diet monitoring is invaluable, guiding our adjustment to medication, diet, and exercise. It's also a critical teaching moment to discuss the importance of data recording and the implications of glucose influence. Within the scope of GDM prognosis, an essential aspect we must address is the timing of delivery. It should be carefully considered in conjunction with our patient's glycemia control. Proper blood sugar management can influence the decision-making process, aiming to balance the risk of prenatality against those of fetal macrosomia and other GDM-related complications. Postpartum care is a critical extension of our GDM management plan. It's essential to monitor glucose levels after delivery, as the hormonal shifts can significantly impact insulin sensitivity. This is also a time for reinforcing the importance of a healthy lifestyle to both the mother and the family, promoting long-term health within the community. As we bring our discussion to a close, let's reflect on the importance of holistic care and GDM management. It's not just about treating the condition, but also about understanding its importance on the patient's lives and family. This is the essence of patient-centered care, where empathy and medical expertise go hand in hand. In our pursuit of providing the best care, we are fortunate to have resources like clinical key students, and osmosis at our disposal. These platforms are treasured truths of evidence-based medicine, guiding us through the latest research and clinical guidelines. I encourage you to utilize the tools to deepen your understanding and stay abreast of the latest development in GDM care and beyond. Remember, the knowledge we gain is not just academic, it's a tool to improve patient outcomes. As future healthy providers, you have the power to make a real difference in the lives of your patients. Let's continue to learn, to emphasize, and to lead with compassion and scientific rigor. Thank you for your attention today. Let's continue this journey of lifelong learning.